tell me a little bit about your condition and what have you had done?
Okay, so back in 2009, end of 2008, I had a bad back, and it got worse over a number of months, 3 or 4 months, and that ended up being a herniated disc, where the disc had prolapsed quite severely. So I went and saw Mr. Schofield and had an MRI scan, and the disc was out quite a long way. So he suggested, based on the severity of the disc being out of position and down on my spinal column, that surgery was the best route to go. I then had a microdiscectomy where he cut out the disc that was pressing on my spine and sealed up the hole. It's quite an interesting animation online that you can have a look at that tells you exactly the procedure. If you're keen not to freak yourself out, then that's probably not the thing to do, but I did.
When did you have this done?
Done at the Runnymede, March 2009, so just over 5 years ago, and yeah, it was fairly straightforward.
And from your point of view as the patient, I mean, what did you really appreciate the most, do you think, in terms of the treatment you've had from Mr. Schofield?
He was really clear about what the issue was and how bad it was, and what his recommendation with his experience was the solution, you know, how to get to the right solution. He was positive about the recovery and where I could get back to. You know, he was fairly clear that I could get back to doing all the things that I enjoyed doing.
So you were well informed?
Yes, yeah. He identified that there were potential additional risks. You know, once you've had one and you've had the op, there's the opportunity, you know, albeit minimal, of a second situation. But you know, when you've got the stats in front of you, you can really understand that and make the right choice.
And so 4 or 5 years on, how is your back now, and how is it impacting your life?
I think overall I'm doing all the things that I was doing previously. So I'm back playing golf, I'm in the gym, I'm probably fitter and stronger than I was. I've had really good physio support after the fact, so I work really hard on my core. It's probably not as strong pre the op as it is now, but I'm throwing kettlebells around and all sorts of things, so quite significant, you know, movement. I throw the golf club around quite severely as well. I don't hold back. So you know, it's my life in total is as good as it was before.